with Dr. Dachowski.
Welcome.
Today we're going to talk about when you should go to... Today we're going to talk about when to see a dentist or another doctor and when to come see an oral surgeon. Let's talk about it. General cleanings.
General cleanings are best performed by your general dentist and their hygienist usually.
Veneers.
Veneers are what are considered cosmetic dentistry or aesthetic dentistry, and they're best performed by a general dentist. And there are certain people that describe themselves as cosmetic dentists.
A dental implant.
The best person to call for a dental implant is an oral and maxillofacial surgeon. Usually the dental implant process is accomplished with a team, that being the surgeon who does the surgery and the restorative dentist who would create the crown or the teeth that would be attached to the dental implants.
Which is an important note. If you're coming to get a dental implant, which we'll talk about in another video, we do the implant. Your dentist, correct, puts on the crown or the part that looks like a tooth.
Yes, the best analogy I can use when we talk about dental implants is the surgeons are the foundation people. We are the people that create the foundation for the dentist to then build the teeth that would go on top of that.
What about bridges?
Regular dental bridges are best performed by a general dentist. Sometimes bridges are an option other than dental implants. It's a non-surgical option, it's a traditional option. At times it's not a bad option for someone to consider.
How about Invisalign? Would you go to an oral surgeon for that?
No, Invisalign is a discipline of orthodontics. Same with braces.
How about if I'm having jaw pain?
Jaw pain could be caused by a variety of reasons. Certainly, seeing a dentist could make sense. Seeing an oral and maxillofacial surgeon could oftentimes make more sense, simply because the etiology or causes of jaw pain could be something other than dental. Heart problems or cardiac problems can cause jaw pain. If someone has pain, they should certainly contact a doctor. Jaw pain, oftentimes they may want to see the oral surgeon. But again, there are a variety of causes for jaw pain. So from a diagnostic perspective, the oral surgeon is usually one who's best trained to at least diagnose the reason for the jaw pain and then either deal with it or get the patient to someone who can.
What happens if I get punched in the face in this area?
You would never get, why would you ever get punched in the face? No one would ever punch you in the face.
You don't know my past. Where would I go? Should I go to my dentist? Should I go to my doctor? Or should I go to an oral surgeon?
Let's just say you had a sports injury, right, or maybe a dog headbutted you. And you were concerned about the condition of your teeth and your jaws. The oral surgeon would be someone who you would contact, because we have obviously the training to recognize injuries beyond the teeth. We have the technology and the imaging devices that would allow us to assess and identify fractures of the jaw, fractures of the teeth, fractures of the nose, the associated areas. Seeing the oral surgeon or visiting the oral surgeon makes good sense for facial trauma.
What about if I needed dentures?
Do you mean you have your teeth already in your mouth or your teeth are already out of your mouth?
Both.
Well, the oral surgeon could be a logical first stop, because the oral surgeon is well trained to assess the medical concerns that the patient may have. Oftentimes, patients that are considering dentures are older, have other medical issues that could affect the outcome and the experience of whatever needs to be done. Once the patient sees us, we can team with the appropriate other professionals to accomplish what the patient needs. And that may include the patient's physician, the patient's cardiologist, the patient's neurologist, as well as the patient's dentist.
How about I just need it out? I just need the tooth out. Where do I go for that?
The best person to call is your oral surgeon and get over to us so that we can A, get you out of pain, B, manage the infection appropriately, and then C, consider what the patient's options may be to put something back.
We get a lot of calls about this. Root canals.
Root canals are best accomplished by either the patient's dentist or a specialist known as an endodontist, that is treatment inside the tooth or in the pulp of the tooth, to take out the disease and save the tooth. Once the tooth has had the endodontic treatment or root canal, it usually requires a crown afterwards. So the root canal is the first step in restoring a sick tooth.
Do you do teeth whitening?
Oral surgeons usually don't get involved in teeth whitening. That's an area that's better reserved for the patient's family dentist or general dentist.
How about I got something weird going on that I may need a biopsy in and around my mouth area? Is that something I would go to the oral surgeon for?
Absolutely. You should get to the oral surgeon and get to them fast. If you have if a patient has an oral lesion that hasn't gone away after a week to 2 weeks, they should call the oral surgeon and have that area looked at.
ASAP.
ASAP.
So thanks for clearing some of that up on when I should go to my oral surgeon, when I should go to my dentist, when I should go to my endodontist, orthodontist. There's so many doctors.
Yeah.
But this has helped. I hope it's helped you.
I hope it's helped you.
It has. So again, if you have any questions too, if you don't know for sure, feel free to give us a call. Or like I've said in all my videos, please go to our website, theoralsurgerygroup.com. There's a lot of answers there, but if you want to talk to a person, we're always here for you. So give us a call if you have any questions. Thanks again, Dr. Dachowski.
Thank you, Laura.
We'll see you in the next video.
Thank you.
Bye.
Bye.